Hi, I'm Dr. Bushra Khan. I'm a consultant in surgical oncology at Star Hospitals, Hyderabad. So what exactly is cancer? When the normal cells in our body become abnormal and they multiply without any control or regulation, it leads to cancer. The most important thing that we should be talking about today is the risk factors for cancer, which I'd like to subdivide into modifiable and non-modifiable risk factors. Modifiable risk factors are those that you and me have a control over. The kind of lifestyle you live and the kind of environmental exposed to you is very important in actually determining your risk for cancer. Having a healthy diet, a balanced meal, keeping your weight under check and avoiding obesity decreases and reduces your risk of cancer. Exercising has been proven in any form to reduce your risk of cancer. Avoiding smoking and alcohol consumption, avoiding tobacco in all its forms, whether rolled, chewed, smoked, is told to reduce your risk of cancers. Certain environmental exposures in terms of industry agents and chemicals have also been associated with cancer. Being aware of these agents and avoiding your exposure to them decreases your risk of cancer. Exposure to the sun in a limit is good, but excessively exposing your skin to the sun also can increase your risk of certain cancers. Coming to the non-modifiable risk factors that you or I do not have a control over. Age is one of them. With increasing age, the risk for cancer also increases. Certain cancers pose a predisposition to certain genders. For example, breast cancer is much more common in females as compared to males. Oral cancers are the most common cancer among men today. Another thing which is extremely important is that you take part in screening camps. In simple words, it means that even though you feel that you are absolutely healthy, by looking at research and the age at which cancer affects someone, you get a certain routine tests done to actually rule out your risk for cancer or to detect the cancer as early as possible. One thing we all need to keep in mind is that early detection of cancer saves lives. Today, with the latest advancements in science and technology, cancer treatment has achieved great heights. We have surgery, we have chemotherapy, we have radiation therapy, we have target therapy and immunotherapy. The best part about target therapy these days is that it particularly targets cancer cells and helps kill only the cells that is necessary. Surgery in various forms of advancement, including minimal invasive surgery, minimal access surgery, and even robotic surgery, has made great strides, and it has overall improved the post-operative recovery of the patient. Nowadays, organ preservation is possible in many cases. For example, for breast cancer, earlier the entire breast would be removed. But today, breast conservative surgery is very much possible and making great strides. In terms of chemotherapy, drug advancements research has been going on to actually cater to the best drugs with the minimum side effects that are available to increase the overall survival and disease-free survival of patients. Immunotherapy uses the patient's own body mechanisms of immunity to actually target and kill cancer cells. How do you know how well a patient is going to do with cancer? It depends upon the staging of the cancer. Staging divides 1 to 4. 1 being the chance that the patient gets recovered maximally, and 4 with a chance only of control and no chance of cure of cancer. Why do we say that it is important for you to screen for cancer? It is mainly important because at stage 1, if a patient is diagnosed, the chances of cure are more than 90% in certain cases. Cancer is one disease which mentally, emotionally, financially, physically drains a patient and his or her family. Patients who undergo treatment with cancer also suffer from what is called as PTSD, post-treatment or post-traumatic stress disorder. And they need a lot of help, not just from their family, but from their community, from their treating doctors as a whole. Let us all come together in actually supporting patients who get diagnosed with cancer, letting them know and letting them be guided to the right treatment in the right direction. Thank you.